Welcome to finishing plastic for a transtibial prosthesis. This video will go through the process of sanding and finishing the trim lines of a transtibial prosthetic socket. For this video, you will need a transtibial socket that is cut down to approximately 3 centimeters or less from the trim lines, a Troutman, and 3 types of finishing cones that will be discussed on the next slide. Safety glasses are highly advised while using the Troutman. While finishing the socket, small pieces of plastic can be pulled off the socket and go in any direction. Please follow your own works policy and safety precautions on top of these. The types of cones we'll be using is first a high grit cone. Next, a finer grit cone. And lastly, a polishing cone. There are other cones that can be used, but for this video, we will be solely using these ones. First, we will use a higher grit cone to bring down the plastic to the appropriate trim lines and level out any rough edges. We should be using a long pulling motion to bring down the plastic with this cone. By the end of using this cone, the socket should be at the desired trim lines and have a 90-degree edge on the inside and outside of the socket. Next, we will use the finer cone to take away the 90-degree edges and to create a smooth transition from the inside to the outside of the socket. We are trying to ensure the bony and muscle anatomy is captured in the socket while not causing sharp or rough edges to damage the patient's skin. We will start by tilting the socket to be at a 45-degree angle to the cone. We are going to pull along this edge with slight to moderate pressure using long motions pulling towards yourself. This will be done along the whole inner edge of the socket. Next, we will use the same motion and pressure along the direct top of the socket to further whittle away the edge. Continue this all along the top of the socket. Finally, we will do a gentle pass over the outside or exterior trim line of this socket. We will want to keep this final pass as close to the top trim line as possible to ensure the exterior of the socket is not damaged and there are no sharp edges on the socket. You can check your progress on making that gradual transition by running a finger along the edge as seen in this video to ensure you are making the correct transition. This process makes a nice gradual transition from the inside to the outside of the socket without any sharp edges to hurt the patient. Lastly, we'll use the polishing cone to smooth out the contour transition along the trim lines of the socket. We will want to do long, gentle passes along the trim lines using that same pulling motion to ensure to keep the shape and transition we just worked on. Gentle, long pulling motions with this cone will allow for the longer use of the cone and better contour around the trim lines. The polishing cone will give the socket a nice aesthetic appearance and touch for the patient and the long-term outcomes of the socket. Finally, clean out the socket with any cleaning agent that your lab facility normally uses. Good luck with your fitting. Thank you for watching.